Long time no see.
Perfect.
Awesome.
How's the baby, by the way?
Oh, thank you for asking. I'm actually in her nursery. This is also my makeshift office.
Got it.
She is doing great. Thank you.
Awesome.
She's 4 weeks.
Congratulations.
Thank you. Yeah, she's 4 weeks as of Wednesday, and doing awesome. And she's getting to hear Dad talk about orthopedic applications, et cetera, et
hmm
cetera. So it's been good. How are you and your family?
Oh, they're doing fine. My kids are just bored. My kids are range all the way from I have a 17-year-old in high school all the way down to a almost 8-year-old. So she's
Wow.
counting down the days to her she's my caboose. So she's counting down the days to her birthday because her birthday's here in a couple weeks. So she's
Oh,
pretty
okay.
excited. So
Oh,
she's gonna
great.
be
Happy
8.
early birthday. Happy early birthday.
When your youngest turns 8, that's when you know you're kind of like, oh my God, I'm old. So
That's hardly true. Hardly true. Um, the it's so funny now. Like literally, my rep. I was in the OR earlier. My rep had for the case I was doing. His kid was literally born like I don't know 6 7 hours before
oh
before
really?
mine, and so now we were just talking about changing diapers, formula. He
hmm
was asking me what formula are you using, and I was like, this is what we talk about now.
This is it. This is what you got
And
to do
I
now.
was like, hey, I'm honored and privileged, honored and privileged. Well, we'll give it just another minute or two as people are coming
Sure.
in here. What you'll notice is that at the bottom, so lots of people will kind of can ask questions, and of course, if you see something that's maybe specific to Northwestern or in general that you want to
Okay.
jump in and answer, by all means do so. I try to incorporate all of that, as I was saying earlier. I try to incorporate along as we're going along, but just in case if you see something, that's totally fine as well.
Sure.
So, how many applications have you all gotten so far this year?
It was maybe 100 more than what we usually get. Kind of
Okay.
comparing notes with like, Mel Harrington and I are good friends and a couple,
Yeah.
just different people. It doesn't sound like it
Yeah.
was a lot more. I think everybody was petrified that it was going to be like, 1,000 and something, but
Right.
it ended up being about 900 and something, I think, when we
Okay.
were all said and done with it. So, yeah, not a
Okay.
lot more than what we usually look at.
Do you think, was there any reason why you thought that there was a spike this year? Do you think it's because of maybe what Northwestern's sort of been doing on the social media side or otherwise, or has it been just because of, you thought maybe because of the COVID sort of anxiety?
I think it was COVID anxiety. I think that's kind of part of it. I think certainly we've put more effort into the kind of the social media presence
Sure.
this year than we've had in years past, but which I think is probably a good thing. But I think it's also that the kids are nervous, and I don't
Yeah,
blame them.
yeah, no, that's you're absolutely right. I was actually talking to a couple students just yesterday who, with whom I had spoken about, hey, apply to this number because this is where you sort of fall in the ranks, if
hmm
you will. And of course, some of them heeded my advice, and others just, went
Shotgun
the
approach.
opposite direction of like, the Hail Mary of
Yeah,
applying to every program underneath the sun. But yeah, it'll be interesting to see how things play out for everyone across all
hmm
institutions. With that in mind, with no further ado, first off, everyone, welcome back to behind the scenes conversation with a residency program director. I'm Tabs Iyer. I'm a faculty at University of Miami and co-founder of Ortho Mentor, and I'm really honored and pleased and very humbled and privileged to have Dr. Matthew Beal, uh, program director for Department of Orthopedics at Northwestern University, join us tonight. So, really a big, round of applause to Dr. Beal coming in tonight to hang out with us. Dr. Beal actually did his medical school training at the Ohio State, which has been playing pretty well from what I've been
they
watching.
have.
And, and did his residency training at University of Chicago, Department of Orthopedics, and went on to complete an arthroplasty fellowship at Mass General, affiliated with the Harvard Hospitals in Boston. And he's been now a program director at Northwestern for a little bit of time, and we're really honored to have him and have you on tonight, my friend. So I really appreciate you being here today.
Thanks. Thanks for having me.
No, no, of course. What I really want to just sort of start by is kind of get a feel for your experience as a PD. So you've been a PD now for how long, and what sort of major lessons have you gleaned sort of over that period of time?
So I took this job. So I was on faculty at Ohio State, and I took this job mainly because it gave me the opportunity to be the program director. And now I've been doing it for a better part of 6 years and change. I think that it was an opportunity that I wanted just because I wanted the challenge of actually trying to kind of mold and build and shape. Because I think everybody, gets to a certain point that the thing they really want to do is make something beyond just being a surgeon. And I think my make something was to kind of take a program and build on it. I'm probably going to get photo bombed by a very curious golden retriever. I think that I wanted to build a program that I could be proud of and kind of mold it into what I thought worked right. And this gave me the opportunity to do that. And I think some of it was also having a chairman that was very sympathetic to my cause. And he was my program director when I was at U of C. And for people that don't know who Terry Peabody is, Terry Peabody's a huge resident advocate. So it gave me the opportunity to have a boss that was very interested in education, very interested in kind of resident advocacy, and gave me a long leash as a new program director to kind of make it into whatever I wanted to make it into. So he kind of trusted me to make decisions and make changes as I saw fit. It also kind of dovetailed nicely because it was at the period of time when CPR 6 guidelines were coming out and everything was kind of changing anyway with how we evaluate people. So it kind of fit nicely that I was kind of the new guy because we needed to, go in and change everything anyway. So it really fit nicely together. But it was definitely, I think at first, I think anytime you take over a program that has a lot of culture and a lot of history attached to it, like this place does, there's a lot of sacred cows and there's a lot of things that people don't really want to change. And sometimes they need to see the other side so they can really see if it's going to be better. So I think they had to learn that they could trust me to make changes on their behalf. But I think a lot of that just came with a lot of talking and a lot of conversation.
In that way, how has that sort of ebbing and flowing with, what may have, cultural barriers, as you're saying, within the program or initial confines, how did that sort of shape your vision of the program and sort of how have you sort of see it grow and change even over the last 6 years specifically?
Well, I think, first of all, some of the things that were really good about this place I didn't want to touch. And I think when you take a job like this, the first thing you have to figure out is what's really working well so that you don't mess that up. And, I don't want to come off that I'm like the smartest guy in the room because I'm not. I just wanted to make it even better than what it had been. And clearly, the one thing that stood out about this place was the didactic programming was really strong and it was really well thought out and well run by the resident cohort themselves. They put a lot of onus on each other to perform when it came to didactic sessions. So I didn't have to do that. But what I did need to do is I did need to make sure that the faculty had more oversight than they had in the past, just for quality control and things of that nature, and making sure that the faculty had even more of the kind of the talking in the room, but also give the residents the opportunity to kind of run their educational programming like they like to. So they have certain things that they protect where there's no faculty there. The best example of that is they have a fracture conference on Tuesday nights, which they tend not to invite us to on purpose because they want to go through it and the chiefs want to run it. And they want to make sure that the junior residents are really aware of what they're supposed to be doing as far as fracture classification and how they would approach different injuries and just management before they get in front of a bunch of attendings. So I think it kind of changes the quality of conversation in the room, which is a good thing.
Right.
But I think there's some things that you just have to kind of wrestle with people a little bit on. But again, I think it boiled down to just clear lines of communication. I meet with them every week. So I talk to them literally every Friday about things that are going on and problems they have and things they'd like to see improved upon. And then I also communicate things that I need them to do. So it's a clear dialogue just like this,
Right.
which makes it a lot easier.
That's actually super interesting that you meet with them on a weekly basis. Are you meeting them sort of in mass with like the whole cohort, or is it sort of in week to week, changed by resident, or is it based on, you guys have them divided up into like little like, sections, if you will? What kind of guided, that sort of, or guides how you kind of run that?
So where I train, so a lot of this is kind of how I grew up, so to speak. So I grew up with a program director that I could, if I needed to, I could go in and set a meeting in the middle of the day and try and get in and talk to them if there was something going on. So I wanted that kind of format. So I wanted to have the ability to have the one-on-one conversations, but I also wanted to have a more open town hall kind of format, because I think it's nice for each level to hear what the other levels have to say. Most recently, there was something that the interns were talking about, their vascular rotation that they do with the VA during their first year, and they were thinking about changing it because it was a little slow and they wanted something a little bit busier. And they were quickly advised by the senior residents in the room that if I changed it, they may get more than they wanted for that they may have a very busy month on vascular at the main hospital, and that may not necessarily be a good thing.
Okay.
So I think it's kind of a variety of different things. So it's a lot of open door conversations. I meet with them a couple times of the year. That's kind of more scheduled one-on-one time. And then this format works well because it does get everything out in the open for everybody. And that's been something we've done from the very beginning. Peabody and I sit down with them literally every Friday
Wow.
before grand rounds and talk about everything that's going on. This week, the reminder was, hey, you guys have a quiz on Saturday because you have to take the in-training exam, and
Right.
here's how we're going to do that. We're, of
Right.
course, not meeting in person right now. We're doing it more like this.
Right.
But it's still, it's nice to be able to see people. It's the kind of the social animals that we are. And it just allows us to do that. So I think it's been very successful. And I think it's one of the reasons why I think when people come and actually see our program, they can see kind of the connectedness that the faculty has to the residents, because we literally see them all the time.
Yeah. How do you think having your current chair as your prior program director from residency, how do you think that has sort of either kind of guided sort of your how your evolution of as a program director, and how do you think that sort of has influenced sort of what you see in that vision that you were describing earlier?
Well, I think that the reason that so I can tell you the story that when I interviewed with them down there, I had a one-on-one interview with him. And I can tell you at the end of that interview, I instantly was on the same wavelength with him. So I knew that was a place that I could grow, and I knew that he had the right frame of mind as far as his priorities of what he wanted to get done. There's no hidden agenda with him, which is kind of nice. And he obviously has to put the clinical mission for first and foremost, because he's the chair. But the education thing, it's huge for him, and that's where he's done a lot of his work. So I think it just rubs off on everybody else. So then it's like a trickle down phenomenon with the faculty that he grabbed from all the other places. So whereas in the past our place had been a little bit more of a private-demic looking group that was kind of focused in the downtown area, and had a kind of a nucleus of people that were still good, but they stayed pretty concentrated there and didn't do a lot of very academic kind of things. Now you got people that are going out and giving talks and going to meetings and doing all these things and doing research, and it helps the mission, which is that it still follows down to education. And then it just keeps trickling down. So now that we've all been there for now 7-8 years, and then had this process growing. Now I have residents that are coming through that have gone all the way through, where this is just kind of what we do. So now you have this culture shift that now it's an academic program that is very education forward, and now you got residents involved in education research and wanting to go to leadership meetings and committee work, and they want to be involved because they see us do it, and they just kind of think that this is what you do. So that's why we tend to have those kids gravitate to us, that if they're really interested in the process, this is the place to go because we're the ones doing it. So he and I do a lot of stuff with the AOA and through CORD and different groups to try and kind of push the agenda. So yeah, it just kind of fits.
So on that note, and obviously, and I know that you've done a wonderful job with a lot of the AOA/CORD stuff. So tell me, at least from your perspective, what kinds of things are you looking for in this cycle, especially in light of these sort of cultural descriptions you're sharing with us? What are you looking for in residency applications in this cycle, and do you think it's changed at all, especially with COVID now? Has it changed sort of in terms of parameters you may be paying more attention to relative to prior years?
So I first of all, I feel for the kids that are going to go through this cycle, because they didn't really get the full experience like you and I did. where you could actually go around and look at places and actually see, is this someplace that I want to be? Is it? So I think you end up kind of doing more of a virtual walkthrough with different people, but it's not the same as having to be, in a place and working with people for a month. So I think a lot of this, this cycle, what am I looking for? Not anything different than what I've always done. I think that, I had a conversation not long ago with Scott Porter, who's in Greenville, and Scott said some things as far as what he looks for, and I think he and I are very much on the same wavelength. I like people that are first, first of anything, first doctor in the family, first orthopedist, first kid to go to medical school. I think a lot of times those kids have something to prove, and they tend to show up and do their job. I think that I like to see a little bit of grit, some folks that have maybe hit a couple bumps in the road and were able to survive that and kind of continue to flourish. I think that shows some ability to kind of handle that, because I'd love to tell them all that, life once you're an attending is just smooth sailing, but you and I both know that's not always the case. So I think you have to be able to, let the water run off your back a little bit and know that that's going to happen. So I think it's a little bit of grit, having some, skill, with just managing people and managing and leading, I think is something that I look for. Because that's what I want to create. So I think that's the kind of the nucleus of this place. So I think those are some quick things that I would look for in this cycle. There's kind of the standard things that everybody looks for. We don't do a cut score on, step one. I'm kind of done with that. That test was never intended to do that. So we just kind of threw it out. So we don't use that anymore as a metric for whether we look at somebody's file. But I also I don't do them all anymore. So I used to look through all 800 applications all by my lonesome, which was a painful process.
Yeah.
But now I have a team of about 10 to 12 faculty that we do it as a group, and we have a scoring metrics that we use, and we kind of trust each other to score it the way we want it, and then we stack it, and then off we go with the interview process. So it's made it the work of actually getting through everything much easier, but it's also allowed us all to do a more quote unquote holistic review of the application. So we look at letters, we look at the personal statement, we look at the dean's letter. So we look at everything.
It's interesting you bring up the notion of getting rid of the screen, especially in light of the fact that, as you and I both know, that step one going to pass fail, and perhaps maybe step two even taking maybe more of the brunt of the weight or focus potentially. With that in mind, are there other things that you and the selection committee sort of look at from a kind of maybe objective perspective, in the sense of, obviously the letters and even the standardized letter can be somewhat, subjective in nature and can vary, even personal statements, right? So are there things that you have at least observed at Northwestern that are, hey, like someone who's got maybe, is it more research or more like, international experiences or whatever it may be, that are a little bit more consistent with the kind of kinds of applicants that are coming through and then matching at Northwestern? Anything in particular that you can kind of put your finger on?
No, I think, there's kind of the standard things that I think everybody does. I do look for, prior history of leadership and kind of service. And that can be defined a lot of different ways, to be honest. That can be in their community, through their church, through some other organization that they're a part of, whether it's, SNMA or, their student government organization at their school, or just showing that you have some commitment to the greater good of how people actually are, you're looking beyond yourself, I guess is the point. Because that's very much the way my chair has lived his life. I figured out a long time ago that my career is probably exponentially tied to the careers of others. So in other words, I can improve my own, life and career just by working hard for everybody around me. And that's kind of that, servant leadership idea. Because I think, you're going to see a lot of that in our program, whether it's my chair, it's me, where we're going to work probably harder than anybody else, on these sorts of issues that come up, to make the program better. Because that's just the way that we do it. But I think what ends up happening then, again, it's one of those cultural things, is that you start seeing the program leadership doing that, and you think, you know what, I have to be a part of that. I have to kind of get involved and start talking about how to make this place better instead of just living it. And I think our kids do think about those things as they're going through it, as far as What are the rotations like? How are the cycles going? Is this an appropriate level for this resident? Is there something else that we could be doing? So it's definitely very fluid, and it's definitely created an environment where there's a lot of conversation about it on a weekly basis, which has been a really nice change for us.
So on that note, especially kind of thinking of like how to kind of navigate and change things, hot button topic is like notion of diversity and equity and inclusion. And so, what sort of things are y'all taking, or what sort of measures to be more inclusive, if you will, and kind of enhance diversity through the Northwestern program?
So I think it's one of those things you can't be passive about it at all, and I think that's probably where the problem lies, right? We have a tendency to just kind of think it's going to happen, and it's not about just grabbing somebody or meeting a quota or counting a number or saying we have enough of this and enough of that. That's not going to work. So I think you still fall back to looking at the quality of the person on the paper. Again, you have to do a full review of everybody, and then you have to look at kind of the experiences that those people brought to the table. I think that, what opportunities they had and then how they actually used those opportunities. So we have been out, at SNMA events. We have been at, Ruth Jackson events. I'm a mentor, and I've done some interviewing and some mock interviewing for Ruth Jackson this year. I'm a Caucasian male, and I'm still out doing this because I still think it's important for people to do it. And again, it makes no sense for me to sit back and just kind of let it happen or let somebody else do it. I've got to be out there doing it and supporting people. But at the end of the day, what does it boil down to? It boils down to, opportunities you had and how you use those opportunities. So I tend to be probably less biased than most, because that's how I've always kind of lived this. But I still think you have to actively participate in that. You've got to get out and do nth dimension work and go through Gladden and RGOS and the Latin Orthopedic Society, and you got to go do it. So I think what you're seeing from us now is that we just have a push. My junior partner is one of the assistant deans for diversity, and she was one of my residents, and I was lucky enough to have her actually come back and actually join our faculty. So Linda Suleiman is kind of my eyes and ears in that world, and I literally tell Linda, like, what do you want me to do? When do I have to be there? And how, what do you want me to talk about? And that's been big events where it's big town halls, and it's been one-on-one conversations just like this with applicants. And I think you just have to spend the time, and it's not just to fill a number. It's to actually, look at opportunity and look at somebody's credentials and talk to them and figure out who they are. And that's it, which is what we do for everybody.
Yeah, and I think that, it's absolutely incredible, and the fact that that you and sounds like the entire program are being so proactive in that way, I think is really a testament to the wonderful nature of Northwestern's program. So kudos to you all. One question that came up earlier, kind of talking about that notion of grit specifically, maybe overcoming adversity. Someone had asked if they had received a misdemeanor charge, so criminal charge prior to medical school, would that kind of deter y'all's review of their application if there clearly hasn't been any other issues since that point in time, or would it be something where that application gets screened out altogether?
No, that's not something we tend to use as a screening tool anymore. I tend to look at everybody's stuff, to be honest. And you just kind of, I've definitely had that. I've had residents in the program that have had those issues. Where you did something silly when you were in college. Everybody's been, a drunk college student at one point in their life or another and done some things that they probably shouldn't have been doing. And we all grow up and kind of learn our lesson with it. So, I'm not going to keep, judging somebody. I'm not in no position to do so for something that happened, 5 or 6 years ago, when they've obviously kept their nose clean and done what they were supposed to do. So if all other things being equal, no, it's not going to probably hurt them all that much.
Okay. And the other question was, are there, in terms of, I guess, fellowship matches, are there from Northwestern specifically, are folks going into oncology in general, or is it sort of, what kind of fellowship matches is Northwestern producing?
It's all over the place. So that's probably one of the, vital signs for our program. That's one of the ones I tell the students to use when they look at places is actually what are people going into? If it's all one thing, like if everybody's doing sports, you start to worry, is that the strongest thing they have? Is that just where the best mentorship is? You worry about that a little bit. And I would caution the students that you do like to see a program that produces people that go into a lot of different things. So yeah, we have people that have gone into every single subspecialty in the last 3 to 5 years that you can think of in orthopedic surgery, including Shelbo, which is a little less common, and onc. It's not like we're the oncology factory. We've had a couple people recently do that. One of my chiefs this year is scheduled to go do her fellowship next year at University of Florida for their oncology program, which is one of the best places to go in the country for tumor. We've had, for the last 4 or 5 years, I'm starting to lose count, one of our residents has been the HSS Sports Fellow. We've had people go into spine at good places, whether it's Jefferson or, the places that you would think of, or people going into joints at Harvard's program, or to go to Stanford, or, it's just across the board, UCSF, you name it, we've got it. And I think that's because it's a tight group. There's only 3 sites. They're all kind of centrally located, so they're around the faculty all the time. So the faculty really knows who they are. So, it makes sense then when we write letters for them, they probably sound pretty good. And it's not uncommon for us to make phone calls because I see them all the time. So I can make, phone calls on their behalf, and I can be fairly open about who they are as a person, not just how they perform on a rotation.
And that's really wonderful to hear that you've got that sort of diversity of even like fellowship matches as well, kind of across the board. How are y'all looking at, reapplicants, folks who didn't match maybe this past year or year before? Do you guys look at them just with as much scrutiny as the regular first time applicants, or do they get kind of a different sort of vibe check from you all?
They get the same kind of look. So we end up looking over their CV and their application roughly the same. What ends up happening sometimes with those folks is, you get scrutinized more so, and that's a tougher road to hoe, and it always has been. I think sometimes it's, when you look at that application, you might find a glaring issue. In the past, it was a step 1, but now we kind of gotten past that. I do look at people's grades. So how did you actually perform on your clinical rotations during your 3rd year? Because that's a little bit more of a longitudinal look at how you actually perform as a doctor, to see if they did okay with that. If that looks okay, and their grades look pretty good, their scores look okay, a lot of times what will happen is then it boils down to kind of a strategy problem. That person just didn't apply well, and that's oftentimes not their fault. It's actually sometimes that they did not get the best mentorship whatsoever, and they didn't strategize how they actually applied. And they maybe, picked from the top of the menu from all the places they looked at. And that person very quickly fell to the middle of the list at a lot of different places. And they just kind of fell through the cracks. And, there's a couple people this year that I looked at, that one of which I know is out there, that I need to probably talk to on the phone to kind of see how they are doing. Because there's somebody that I know, as I looked at a few of them that were in that boat, that I couldn't figure out why the hell they didn't match. Right. And the only thing that I could figure was that they just didn't apply smart.
And I think that's, super, super critical that you're highlighting the notion of the mentorship aspect of things. And so at Northwestern, do you guys have, like, even for the residents, obviously, and even for faculty, do you have formal mentorship programs in place, kind of even beyond that of that weekly meeting that you're having every Friday?
So I used to assign people, but I always screwed it up. So I think what ends up happening is that based on interest or who you end up, because you interact with everybody pretty quickly in the program, that you tend to jive with one group or another, and then you start going down the research pathway, and then that tends to drive who your mentors are, and who you end up jiving with, and you tend to kind of go to them for guidance and advice more so. They know they always have me. They always have Peabody. They always have Kevin Hart, who's my assistant PD, that they can go to, and they're pretty comfortable with that. But then they tend to do it based on those things. There is a kind of a, somebody asked about research, but it is a kind of I hate to say the word formal, but it is kind of a formal plan that we have in place now, through Wellington Sue and his lab, that his wife runs, because she actually works in the lab and runs his lab. So Erin Sue runs a program that starts actually when they're a first year, that the expectations are set on what they're supposed to be doing. And that tends to drive them to certain people, because they rotate with folks. There you go. I thought I lost you.
No worries. You were just saying that so Dr. Sue's wife kind of has a formal program for the residents to sort of get involved with research, sort of starting from like off the bat, like when they're interns even.
Yep. The expectation I tend to look at research that we are not a research power place, so we're not
Mm-hmm.
going to ask people to publish 25 articles by the time they're done.
Yeah.
My expectation is that yes, they should be able to get through something that's publishable by the time they're ready to graduate, just so
Yeah.
that you have the experience of actually going through the process and actually understanding how to actually do the IRB, get grant money, actually critically evaluate research, so that when you graduate, you can actually look back at things and see if it's something you want to do to change your practice. But that being said, most people do a hell of a lot more than that. And that's just because everybody now understands that it's a process where we now have a lot of extra support for them. There was no research infrastructure at this place when I got here.
Mm-hmm.
There are now multiple research coordinators, statisticians.
That's
There's
awesome.
more people around to kind of help them get some of that stuff done. Those folks are all housed in the clinic space, which is kind of nice, so that when patients come in, they can actually be evaluated. So if we have questionnaires, we can do some of that stuff through Epic, which is our EMR.
Mm-hmm.
So they can go in and do essentially, promise scores
That's
on
great.
patients live, on anything you could imagine under the sun. And then some of them decide to do other things that they want to do. They want to do kinematic work, or they want to go out in the lab and go into the biomechanics lab or the gate lab. And that stuff's out there that they can use. And there's even a few people here and there that'll do a basic science project and go into Wellington's lab and do some things. So it's here, and
Yeah.
it's not often something, I don't shove it down anybody's throat, to be
Mm-hmm.
honest, because that's not everybody's cup of tea.
Right.
So I do have a requirement, which is kind of funny, that I will tell them, and if the students have talked to my residents, what they'll hear is that you got to do something else beyond just become a surgeon. It's just not enough to, that's the low bar to clear most programs. If your goal is to just be technically proficient and get enough cases, well, you've eliminated almost no programs from your list of possible places that could, fulfill that goal. The bigger thing is, what else do you want to do? Do you want to go get your MBA? Do you want to go and get your, education certificate, or your master's in teaching, your
Right.
master's in science? Do you want to go in the lab and do a bunch of research? Do you want to do educational work? Do you want to do community work? Do you want to go overseas and do volunteer stuff? You can do that, but not everybody wants to do that. So I'm not going to require it, but I'm going to ask you to do something.
Hmm. Yeah, I respect that tremendously. And speaking of overseas, a couple students have asked, do y'all look at international medical grads, including folks from the Caribbean? Is that something that has either not been there before and is changing, or are you still not looking at them, or have you always looked at them? Period.
I would say we probably haven't looked at those folks recently as much, and I think that's the honest answer, because I think
Yeah.
because there are such a glut of U.S. grads right now,
Mm-hmm.
we just haven't done that.
Mm-hmm.
I have had people that have rotated our place that have been from those from those places, that have had a better chance of actually coming to our place because they actually took the time to come and look at it.
Right.
This year, obviously, that's different.
Right.
I've had osteopathic residents in the past that have come through our
Mm-hmm.
program. It has been a long time since I've had one of those folks in the program. I think there was one when I was maybe my first or second year here, but it has been a long time since we've had those folks in the program as well, mainly for the same reason. It's not that I'm not looking at them, it's just that I have such a glut of MD grads now. And I think our program, because it's grown in popularity, that we're getting, pretty high quality folks from great places, that it's one of those things where it's kind of like an embarrassment of riches thing. When you build a good program, people come. It's kind of the field of
Right.
dreams idea.
Right.
Just kind of
Right.
silly to
Right.
say out loud, but that's kind of what it ends up
Right.
being, is that if you build
I'm
it,
thinking
people
it.
will
I'm
come,
thinking.
and
Yeah.
that's what happened. And
Yeah.
last year was a kind of a weird match for us.
Mm-hmm.
We, for 6 people, I can be honest, we usually don't go much below like our 20 something person in our list.
Yeah.
And last year we went to 12. for
Wow.
6.
Wow.
So, and it's kind of each year it's kind of marched up the list where we don't go very deep. And
Got
I
it.
think that's probably just because everybody's kind of getting that, we are who we are and they like it. So,
Right. That's really good to know. Another really important question is very super timely as well with the, kind of interview dates or interview release going out relatively soon.
yeah.
Are letters of interest sent to Northwestern, do they carry any weight, whether they're coming to you directly from faculty, mentors, and advocates, or coming from students to, the coordinators, as an example?
I think for everybody, it makes a difference if it's somebody well. I think it
Yeah.
does, and I think that's the same thing when we play the fellowship game. If somebody
Mm.
calls me or emails me that I know and
Mhm.
advocates for somebody,
Right.
that's obviously got a hell of a lot more weight behind it.
Right.
Um, Clearly, students can indicate interest, and a lot of them have done that already. Whether the folks that had indicated to us that they wanted to do an away rotation before the whole thing fell apart,
Right.
or you had some people that came through and actually emailed, or had faculty members actually email on their behalf. That has happened. So I think it makes the heaviest hitter is obviously somebody that I know that emails me and says, "Hey, Matt, this is a good kid. You should look at this person when you come
Right.
and go to your interview." If they know somebody that's a resident in the program, that helps. That resident in my program, I have a couple of my residents that come forward with names. They're like, "You really need to look at this person. They're solid. They'd be a good addition." It's that kind of thing. Those sorts of things probably carry more weight than an email from somebody that says, "I'm really interested in your program." That's,
Got it.
I do get a lot of those.
Yeah.
So it doesn't carry as much weight.
Got it. One of the things I really want to make sure we focus on is, what would you consider is Northwestern? And so what would you consider sort of the top three highlights, top three highlights of Northwestern's program, especially now with you being at the helm in the program director role?
So I think that we are creating people that want to be leaders in the field. That's one. I think two, our faculty group, Mike Stover said this. He's one of the trauma guys at one of our leadership conferences, probably about 6 months ago before everything went sideways in the spring right before everything broke. Um, he said in a meeting, we've always been really good at the mentorship piece, but we're even better at the sponsorship piece. And I think that's an important distinction to make, is that we really do a good job with actually sponsoring people to, sometimes that means it's uncomfortable, right? Because that means I'm going to put people in positions where they have to go up and give talks and be at the podium and
Right.
actually have to perform in front of people. But those uncomfortable moments are growth for that person, growth for their career. And again, it still comes back to the thing that my career grows if
Right.
I can have everybody else's career grow.
Right.
So I put them first. So I think sponsorship is another critical thing. And then I think the last thing that goes without saying is the didactic programming has always been exceptionally strong at our place, and it continues to get better. So, the standard stuff of operative volume, and, the biggest gripe I got from a lot of our students is, what, Dr. Beal, I go to these sessions and everybody says, "I've got great autonomy and a lot of operative volume, and I get to operate." And it's like, yeah, you get to do a total knee from the first day you show up in the joint from start to finish, and it's awesome. And that's just not true.
Right.
I would love to tell people that it's a graduated autonomy program. Yeah, you get enough volume, but I think the didactic program, you got to be ready when you walk in the door, because people are going to Q&A you, and it's going to be constant, as far as, why are you doing this? What's your indication for it? How are you going to get there? What equipment do you need? How are you going to get yourself out of a problem? When should you not be in the operating room with that
Right.
person? So I think because of that, I think our folks, I think what the trickle down from that has been is that when they go to fellowship, those fellowship directors want them, because they know when they show up, they're ready to roll. Their hands are going to be good, but more importantly, their indications are going to be nice and tight, and they're going to be well read, and they're going to be ready to essentially perform as a junior attending.
That's awesome to hear. What, you were talking about, hey, how you kind of get feedback from the residents on a regular basis, which is absolutely, I think, critical. What kinds of things are you all working to improve upon at Northwestern?
So I think, all the time I'm looking for things that I can do a little bit better job with. It's one of those things when you reach a certain point, you have 80% of your program running really well, that now you're just
Mhm.
nitpicking, right?
Mhm.
So we had to prepare for some people to retire because we had some attendings that were getting to the point where they were preparing to go down that road.
Right.
So you have to start backfilling and actually making sure that you have level appropriate folks in each division. So we've hired some more people. We've been fortunate that our program's done well enough and that people like it enough that we've been able to grab some of the folks that either were old fellows or old residents to come back and actually join the faculty group. So we've had growth in sports, growth in spine, which we probably needed a lot, to be honest. So spine was that we got another traumatologist with one of my residents that went away to go to shock and now has come back. So that's kind of shored that up and kind of prepared that. Because again, I think you never want to get to the point where you have, everybody in a division is a full professor. Because then you're just waiting. It's kind of one of those things where you worry that you're going to lose that knowledge base and that skill base that you want that senior person to still be able to bounce thing off of that junior faculty member so then they can in turn bounce it down to the resident. So that was the concern. So, same sort of thing. We've hired into joints. We're going to hire yet another person into joints. So I think we've tried to do that. I think if I was going to add anything, I'd like to add a community level rotation, to be honest. And get them out of the main hospital and out to like an ASC, more an ASC environment where they have to see the hustle and bustle of a high efficiency practice because they don't see as much of that. Our place always gets dinged for the trauma thing. So I love the Google Doc. The Google Doc I laugh at every year. The best story I can tell you was last year I ended up trying to show everybody what our trauma volume looked like at county, because county's where they do most of their level 1 trauma work. And I wanted the 6 weeks right before the interview just so people could see it. And literally in the comments in the Google Doc, it says they're clearly overcompensating because they made a big point about trauma. And it's like, oh my God, I can't win this game. So county is more than busy enough for trauma. And I still have residents every other year or so that go into trauma and do trauma fellowships. I'm not worried about that. So I think the critical thing, some of the changes that we made with the rotation, I'm still a big believer that there are 3 things that people need to do every year in an orthopedic residency. 1 is they need to do trauma. 2, they need to do joints. And 3, not to hurt your feelings, it's not foot and ankle, it's sports. But I think arthroscopy, arthroscopy, joint replacement, and trauma are kind of the core nucleus of ortho. And then everything else kind of takes off of that. There are things that fit into that box. Some of the trauma that foot and ankle takes care of fits into the trauma box, but it's still, you want to see that. And I made sure that you saw all of that before the end of your 3rd year. So before people walk out of their 3rd year, when they got to choose a fellowship, they have rotated through every single subspecialty at least once, just so they can see it. So I don't overload them on the front end with the inpatient heavy stuff and backload it with the kind of the more elective surgery. It's balanced kind of across the board. But that's my fingerprints.
That's really awesome to hear, and I think that's really helpful, especially if someone is seeing foot and ankle or someone thinking joints or hand or whatever it may be, then to be able to have that at least a little bit of a, hey, I've seen everything and now can start thinking proactively about it. I think that's absolutely critical, especially if you're thinking of fellowship after residency. A couple of questions just came through, and then we'll kind of get back to some of the other Northwestern specific questions. But someone asked, if your friend is a fellow at Northwestern, can that influence the match process at all?
If that fellow steps up and actually, advocates on your behalf, yeah, that could help quite a bit. The nice thing about having a teamed approach to the application cycle is that you've got multiple attendings from multiple different subspecialties. So chances are that fellow is standing right next to somebody that's on that committee. So somebody that they work with the fellow on a fairly regular basis, that's somebody we know well. If they advocate on your behalf, that should be a good thing.
Right. So great to know. Another question is, and it kind of highlights something else that came up earlier. Do you need, in terms of the application process, do you need ortho-specific research in your mind, or can it be just research in general?
Not necessarily. I think just showing some effort in the research realm is helpful because, again, it's something to talk about on that interview. It just shows another caveat, it just kind of adds some layers to your application, which is nice to see.
Yeah, and if someone's trying to get a research position, I'm assuming an assumption from the question that's maybe a research fellowship type position. What kinds of things should they be including in their email or their message to whomever they're reaching out?
So as far as like so we don't have something right now as far as like a year-long research year
Mhm.
that people can take. There are things that people can do through Wellington Sue's lab, and his last name's HSU, and it's Aaron and Wellington Sue. They actually take people every year for like a research year, and they have been quite productive. And if I'm going to plug Wellington's lab, I'm going to tell you that I'm probably the thing that's most impressive about his process is that I've never seen somebody advocate and mentor so hard for his kids that come through his lab. If you really get into his lab and really work your butt off, you're going to not only get a lot of publications and presentations out of it, he's going to push for you to get you matched. So for those that are out there that are a little worried and they're thinking about going down that path, I would strongly suggest that you talk to Dr. Sue. And again,
That,
his
that
last name is HSU.
that's absolutely wonderful. And I think in terms of just the, the vernacular, perhaps if someone's asking about that, I would just include, hey, what your interests are specifically, why you're interested in the position. Keep it short and brief, to the
Yep,
point, and be very focused with your search. Don't necessarily just email everyone.
yep,
Email with in a very kind of confined fashion as in terms of people whose interests align with yours. And I think you think of
absolutely,
it in that way. I think that'll probably help you out the most. Um,
absolutely.
one other question before I get back to the Northwestern stuff: have any residents not done a fellowship and just done general orthopedics?
I haven't had anybody do that recently. It's probably been 5 or 6, no, actually probably 6 or 7 years since somebody's done that, to be honest. And I think that that kind of fits with the national numbers. It's a pretty small number. It's probably single digits at this point of folks that just go straight into practice. I mean, you definitely could.
Right.
I would say still, though, a lot of people end up doing a fellowship. I think with some of that's with the way things have changed. Obviously, if somebody wants to call themselves a sports medicine doc, now you have to get a fellowship because you have to be able to have a certificate or an ACGME accredited fellowship to take your certificate granting exam. So I think it just depends, but I think most people are doing fellowships at this point, and that's reflective in our residency. I think I haven't had anybody not do a fellowship in a while. But I think
Got
the
it.
nice part is that those fellowships have been out of interest, not out of need. And I think that's an important distinction.
Yeah, that's really good to know. What's the chemistry between the residents like at Northwestern, and what's the chemistry like amongst the faculty themselves, and of course the faculty and the residents also?
I think the residents are just horrible, horrible human beings. I think I hate them, and you can tell by the way I talk about them. No, I think they're all good kids. I think that they work really hard. I think it's definitely a team approach. I don't think I hear some feedback from places where it's very hierarchical, and that's just not the way that our place works. The example I can give you last year, the Chiefs, when they were at county, decided that it was we all go home or nobody goes home mentality because county can be a little rough, especially in the summertime when it's really busy. And they just decided that they could have just let it fall down to the juniors to deal with it,
Mm.
but they were routinely cleaning things up and getting the ship righted before they walked out the front door. And they didn't have to do that. They did that
Right.
because they thought that was what you should do. And the thing that I always tell them, if as the senior, if you want things to change from when you were a junior that you didn't like, you got to be the one to fall on the sword. There's no, for you to fall on the sword, then it changes the culture. So
Right.
you've seen that happen over and over again in our place. That now that instead of this top down thing where the chief walks around as kind of a junior attending, it's now more of a it's they're in charge and kind of making schedules and things, but it's a very teamed approach to how we attack things on a given day.
That's absolutely amazing to hear, and I certainly am. I used to take call, like when I would take call as a chief, I was hanging out with the junior residents in the ER and whatever else, and I think that's like the best way to really foster those relationships
Yeah.
and sponsor even at that point in time. And on that note, how are the faculty themselves? Do they get along pretty well? And in terms of how they interact with the residents, is that pretty again pretty team based too?
Yeah, and I think it's a pretty tight group because I think when Peabody came, he kind of snagged people that had a similar frame of mind, right? I think
Yeah.
with the kind of the education being the undertone, he grabbed people that he knew would fit that bill. So whether he stole some of the faculty from Loyola and from U of C, he snagged me out of Ohio and brought me up. So
Right.
he just kind of grabbed this team of people. There's a lot of relationships in our faculty group that go back a long ways. I mean, I'm not a super old guy. I'm starting to have a lot of gray in my beard, but despite that, I still know some of the folks in our program for more than a decade and a half or more.
Right.
So when you start talking about relationships that have been going on for a decade or two, you know each other pretty well, and I think that shows and how we get along with each other. There's obviously some newer folks that have come in, but for the most part, you've got a nucleus of people that have known each other for the better part of a couple decades.
That's absolutely amazing. And I think that definitely helps also kind of, it corrals the notion of mentorship, that longevity
Mhm.
component, and really kind of espouses that. And a couple of questions that came up here that I want to make sure we talk about is there a hard cutoff as far as how much research an applicant needs to have, especially in light of, maybe coming from like a less research heavy institution?
That's always taken into consideration, and I think I've been doing this long enough that I know places that just don't do a lot of research.
Yeah.
Not to name names, but some of my folks, my Georgetown kids, I love you,
Yeah.
but you don't often have a lot on your CV, and that's okay.
Right.
I've seen that for the last 10 years or more,
Right.
so I know
Right.
how that works.
Right.
So I think the nice thing is there's enough people on the committee that know that there are certain places that just aren't known for doing as much. So if those
Sure.
kids have one or two things, you kind of count that as being the same as somebody who's got quite a lot. And so I think you kind of consider the source a little bit. Folks that are at a place that have a lot of structure and have been able to apply that, you would kind of expect that. Folks that don't have a lot of structure and able to get some things done, you still kind of count that. So I think for me, it's not necessarily the quantity. Having 20 papers where you're the sixth name on the paper is maybe not as powerful as having one or two things where you first authored the paper. Even if it's something that's not orthopedic, it's still something that you put a significant amount of time into. So I think it's quality, not quantity.
Yeah, and I mean, there's a lot to be said about getting research done, period, because it's not easy to do, and especially amidst your, medical school curricular like
Yeah.
obligations, it's even tougher. Do you think that the school that they're coming from, the institution specifically, makes a difference in terms of how you view their application, aside from what you were just referring to?
No, we've actually made a concerted effort to kind of do some things a little bit differently this year. One of the things we found when we were reviewing applications as a group last year is we needed to divvy the list up a little bit more. So we wanted to make sure that, yeah, there are definitely schools that have traditionally been in that top 25 list. Well, there's only 25 schools that can be in the top 25. So
Right.
we tried to divvy that up a little bit so that you had in your list of folks that you were reviewing a few of those schools, but also other schools that maybe weren't in that list. And
Yeah.
what we tend to do as a group is instead of reviewing, names just randomly, alphabetically, which is what we used to do probably 4 or 5 years ago. Now I actually will review cohorts of students from the same school.
Hmm.
So like if, I had, the Baylor kids in my list. So I literally reviewed every kid from Baylor, and you very quickly can start to see, common letter writers and how they're talking about the students, and you can kind of feel out who they're really supportive of and who they really thought was the star in the class
Right.
very quickly in those when you do it that way. But we also
Right.
wanted to make sure that we divvied it up so that you didn't have an exceptional, one person didn't have a list of they've got a bunch of schools that are these top 25 medical schools that are these really impossible places, and then you had somebody else who didn't have that. That's not really that creates a little sort of a sense of bias. So we look at all of them. We've divvied them up like that on purpose. We've tried to divvy that up. We even have a common list of people that we interview, or not interview, but common list of people that we review. So all 12 of us reviewed 20 applications that were common. That 20 was representative of race, representative of gender,
Hmm.
and representative of those schools. So some of them were taken from top 25 places, some of them weren't. And some of that was done just so that we have an internal check for ourselves as a group to make sure that we're not biased one way or the other. Because if I scored somebody really high and my partner in crime did not,
Yeah.
we need to talk about that and figure out why we didn't do a very good job with that. So
Right. Interesting. That's really cool to hear. The another question is, and I think you mentioned earlier, but just to kind of reiterate the point, how many DOs have matched into Ortho at Northwestern?
there has not been anybody for at least 6 or 7 years, I would say. So there hasn't been one in quite some time. And again, I think that's the glut of MD grads, US grads that we have right now,
Right.
that I just haven't had anybody do that for a long time.
No, I think it's yeah, that's good to know, and I know it's varying from different institution to institution. And I'll just chime
Hmm.
in also relative to another question, which was the in terms of your experience, whether it be research, whether it be international exposure, whether it be any volunteer work, whether it be clinical opportunities, all of that can be demonstrative of your interest in orthopedics. Someone was asking about just getting involved in research. I would always, whether it's ortho or otherwise, inclusive of ENT, which is what was asked, I would just say reach out to faculty members at a given institution in that particular department, and that can be very helpful to try to get research positions.
Hmm.
Someone asked now about kind of going back to the leadership notion. What sort of habits and actions can students take now in order to establish themselves as leaders later on?
I think it's some of it's just simple as get involved. Don't be a passive part of the process. I think there's always things that are out there. There are organizations that students can get involved with, and there are things they probably should get involved with that are based on just interest. Some of it's policy. Some of it is based on, I have a lot of students now that want to get really involved with the diversity issues that exist within our field. So they'll end up going into those parent organizations and we kind of push them to do so. Again, whether it's going with Gladden or with the Latin American Orthopedic Association, or going into Ruth Jackson, just to try and get out there and actually be part of the process. I think there's things that are even closer than that. I've had residents actually on the GME committee. There is a house staff group, that's the group that's, think of it kind of like the student council for the residency in the hospital. I've had residents of mine be past VPs, past presidents of that group,
Well,
that actually deal with the issues that come up for the residents in general in the entire hospital, not just in ortho. There's a companion group to that helps out with the minority students or minority residents at the program, because that again gets to that diversity and inclusion issue. If people have an interest in that, it's like, go get involved. It's like, you have time. You don't have a ton of time when you're a
right,
junior,
right.
but you apply it to it and use that time. If it's something, the thing that I usually tell people is, if you expect to put something like that that's important to you on the shelf for 5 years and expect to pick it back up at the end of residency and run with it, that is next to impossible for most of us. So you have to do that stuff while you're in residency, or you just won't do it anymore, because it won't be something you're interested in, because you'll lose interest in it. So I think you have to have the time, you have to have the support, and in some cases you need to have the financial support to actually get through it.
Got it. The someone asked, is the 80 hour per week resident work hour strictly followed?
Yeah, I mean that's a you got to remember where I came from. My boss at U of C was Mike Simon, and Mike Simon was the one that kind of championed that issue. So that is alive and well. And you got to remember, it's more than just 80 hours. There's a whole other list of things that go with that. It's 80 hours. It's 14 off after a 24. It's 8 after 10 hours after being on for a shift. So I mean, there's a lot of things that go into that. So yeah, we're good with that.
That's awesome. Do you think it makes a difference whether someone did like one of those young, kind of accelerated bachelor's or college / med school programs? Make a difference at all?
I think that I think some of those kids, they kind of gone through that process. If I would say anything, I would like them to have some experience outside of that process a little bit. So I'd like them to show something else that they're interested in. And I think if anything, if I'm going to pick if I'm going to pick on them, which I don't really want to pick on them, but it's that those kids tend to not have a lot of other experiences outside of school, that kind of expand or give us the layer of appeal that you want to look at. I still look at those kids, and I think I've had kids like that came through our program that did really well. So I'd say, yeah, we look at them. I don't know that I treat them any differently than anybody else.
Yeah. The just two more questions, and then we'll kind of call it quits here, so we get let Dr. Beal get back to his family. What aspects of Northwestern do you think are contribute to sort of the family aspect of the program, whether it be community involvement or otherwise?
I think that you're going to see people in our program that kind of stretch all the way across that. So I think you have a nucleus of attendings that have they have families, and I think that transitions then down to the residents. So we have residents that are single in our program. We have residents that are married, that recently got married. There are residents that are having children. One of my chiefs just had a baby not that long ago. So I think it tends to, they feel that, and then that trickles down. I think it's the relationship piece. There is this sense that, they can trust what we're doing. I think there's transparency there, there's communication there. So it does kind of feel very tight. I think the thing that's probably, the most interesting about our place is that it's only 3 sites of practice. And because they're all kind of centrally located, those residents are around each other a lot.
Right.
So that size factor of 6 a year and always being kind of together, they are really tight. And my kids are super protective of their program. So when you talk about, who they look at, they want to make sure people actually really fit well with that culture, because you're going to be in the middle of it the moment you show up. So they
Right.
really grab hold of people and pull them in. The thing that I always watch for, that I'd never want to see, I don't want to see people on islands. I don't think people do really well on islands in training. You need to
Yeah.
be part of the group, and I think it's stressful, and it's
Right.
easier to get through it together versus trying to do it all on your own. So I think that they do a good job of actually pulling everybody in right from the jump street.
Right.
And the classes tend to bond really fast, but I think it's because they're around each other all the time.
Got it. Now, kind of along those lines, do you think that influences what kinds of things you're looking for when students rotate, pre-COVID, if you will, and hopefully post-COVID or whatever time that is?
Yeah, I think that I hate the fit factor thing, but that definitely is something we look at. They don't get the ability to say no to a certain applicant, but I take their commentary into the conversation with the faculty. So in other words, if somebody gets along really well and worked hard and was definitely a part of the team, that's somebody that does really well in our program, that understands that team structure and that everybody's got to pull weight, and it's definitely that person's going to do well in our program when they show up. But just know, for those that are maybe thinking about coming to our program even next year, there's probably some of those folks on the line, that, yeah, when you set foot in the door, the joke on the Google Doc that I always see, my little story, is that you're in the fishbowl, and that's definitely very much the case. Is that you can see everything because you're in the fishbowl, but everybody can see you.
Right.
So from the moment you set foot in the joint, people are watching how you interact, how you work, how you answer questions, your timeliness, having some anticipation and some initiative. Those are the things that I think are probably those 1 and 2 for me in particular. So if you're in my operating room, that's what I'm looking for, is you showing some initiative for what we're doing and some anticipation.
That's awesome. I don't want to take too much more of your time here. So everyone, thank you. Let's, nice warm round of applause for Dr. Beal and all his time tonight. I know we didn't get to every question, so if you have separate questions, you can always message me directly. I can pass them to Dr. Beal and get his response separately, or give you my insight and feedback. The recording will be up in a couple of days on our OrthoMentor YouTube channel. Again, Dr. Beal, thank you so much for your time tonight. Northwestern sounds like an amazing program. I hope all y'all get a chance to check it out during this application cycle if you're going through it now. So thank you again.
Awesome. Thank you.
All right. Have a good rest of the night. And stay safe and have a great weekend.
You too.
Bye.
So now let's discuss the Paramixavirus family. Do you remember the 4 viruses that make up the Paramixavirus family? That includes the parainfluenza virus, the respiratory syncytial virus, measles virus, and the mumps virus. Very good. Do you remember what kind of viruses they are? They are negative-stranded RNA viruses. Very good. These viruses are most important